Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in this session we will be discussing about breastfeeding. So, we know that under any circumstances, breast milk is the ideal food for the infant. And the breastfeeding week is observed on first week of August. And the symbols for the breastfeeding has been changed every year. They have been updated every year. We see that in 2019 the symbol was empower parents, enable the breastfeeding. In 2020 we had support breastfeeding for a healthier planet. In 2021 protect breastfeeding, a shared responsibility. And in 2022, the shared responsibility symbol was given, protect breastfeeding, a shared responsibility. And now, presently in 2023, we have enabling breastfeeding, making a difference for working parents. It is observed in the first week of August, okay? 8th month, in the first week of August. So, the breastfeeding should be started as soon as possible, that is within half an hour in cases of normal delivery. Soon following the normal delivery, within 30 minutes, the breastfeeding has to be started. But the World Health Organization recommends in the developing countries that the exclusive breastfeeding should be followed for a period of 6 months. We have studied in the previous video as well in the PNC postnatal care that the exclusive breastfeeding, nothing apart from the mother's milk, has to be given to the baby for a period of 6 months. Only the breast milk has to be given. Along with the breast milk, we started the other protein rich food from 6 month onwards. The protein rich supplements were also started, but it is along with the breast milk. So the breastfeeding will continue for a period of 2 years. It has to be continued for period of 2 years. So, when the examiner asks how long is the breastfeeding done, you should not say 6 months. Exclusively 6 months, along with the breastfeeding. The breast milk. Okay, breast milk plus protein-rich supplement is given from 6th month onwards. Okay. Moving on, the breast milk. So they will ask, what is the advantage of this breast milk? Among the advantages, the main advantage is that it is a higher bioavailability is seen. It is better digested and absorbed compared to the other cow's milk. We also know that it is very clean, hygienic. When we use this, bottle milk, that's cow milk, buffalo milk, a lot of bacterial exposure will occur. So, comparatively, the breast milk will be very safe. It is clean, it is hygienic, it is cheap and available to the infant at the correct temperature. Very important that it is available in the correct body temperature and no need of heating it or cooling it down and all of that. It's available in the correct temperature, and it is rich in lactose, iron, and water. Breast milk is rich in lactose. Don't forget this. It is rich in lactose. We have an MCQ regarding this. So, the breast milk is rich in lactose, iron, and water. Okay. The milk output. So we see that under the normal conditions, Indian mother average daily breast milk output in the first 6 months is about 450 or 500 to 600 ml of milk daily. We see that in first 6 months 600 approximately, or it can range from 450 to 500 to 600 ml daily. The maximum milk output is observed in the 5th to 6th month. Okay, in the 5th to 6th month, the maximum output of 730 ml per day is observed. 730 ml is secreted daily in 5th to 6th month, or the daily output for first 6 months on an average will be 600 ml, ranges from 450 to 600. Okay, the energy. So, moving on to the energy. how much energy value of human milk will be 65 kilocalories per 100 ml. So we see that the energy value of breast milk is 65 to 70 kilocalories per 100 ml. Moving on to the protein. So we see that the breast milk provides 1.1 gram of protein per 100 ml of milk. So per 100 ml, the protein content is 1.1 gram. Okay, 1.1 gram is present in per 100 ml. So if she secretes 600 ml, we see 6.6 grams is observed. Okay, so 1.1 gram of protein is seen in 100 ml. Okay, the breast milk is rich in protein cysteine and taurine, and it is better digested. So we know that the breast milk contains the protein cysteine, and this cysteine is it is useful in cases of premature babies, and the taurine, it is available so that the better digestion of the proteins can occur. Whereas in the cow milk, what happens, the proteins, though they are nutritive, they are not digested completely. Rather, they will be excreted in the infants. They will be undigested, and they will produce this whitish curdy stools in the infants. So we see that the human milk, which contains cysteine and taurine, gets better digested, whereas the cow's milk is undigested and it produces whitish tarry stools in the kids, whitish curdy stools in the infant. And we see that the human milk, in which the whey protein is prominent, whereas in cow's milk the protein casein is prominently found. So we see a comparison made between the human milk and cow milk. In human milk, okay, human milk whey protein, okay, HH, whey protein is prominent, and in the cow milk, casein, okay, casein, again C for C. Casein in cases of cow milk, human milk, whey protein is found. Moving on to fats. So we see that mother's milk is especially rich in fats. It is high levels of polyunsaturated fatty acids. PUFA is what? Polyunsaturated fatty acids, especially the linoleic acid, and also this alpha linoleic acids are higher in human milk compared to the cow's milk. And the DHA, docosahexaenoic acid, the fatty acid, is present in breast milk. It is very essential for the baby's growth. Although the calcium levels will be low, but the fats, it is very rich in PUFA, that is polyunsaturated fatty acids, that is linoleic acid, and DHA fatty acid, which is present in the breast milk, which is essential for the baby's growth. Moving on to the vitamins and minerals. So the vitamin A and C is found high in mother's milk. Highest vitamin C among the other milk is the human milk, okay, human breast milk. So we see the breast milk is rich in vitamin A and vitamin C. Breast milk, you can see breast milk in the middle. Breast milk will be rich in vitamin A and vitamin C. Deficient in vitamin K, B and D, the breast milk, okay, we saw breast milk rich in A and C, rich, whereas B, it is deficient. Along with D, we have BDK, okay, B, D and K, it is deficient. But now the recent studies have showed that the vitamin D is present in human milk in the water soluble form. So the earlier teaching that it was deficient in vitamin D is no longer accepted. They have said that the vitamin D is present in the water soluble form. So the recent work also has shown that the iron is also contained in human milk. So the recent studies have shown some progress that the deficient vitamin D and iron is present in the biodegradable forms, in the water soluble forms. So it is no longer deficient, it is not accepted. But like the following the textbooks, we see that they have said vitamin A and C they are rich, and vitamin B, D and K they are deficient. Moving on to the minerals. So we see that the human milk is rich in minerals like copper, selenium, cobalt. Than the cow's milk, we see it is rich in copper, cobalt, and selenium, and also iron. In the first picture itself, we saw in the first slide, lactose, iron, and water. The human milk is rich, that is, breast milk is rich. Along with that, copper, cobalt, selenium, and iron, it is rich. It is low in calcium and sodium. So we see that breast milk is low in sodium and calcium, it is low, but the ratio of calcium to phosphorus, okay, the ratio of calcium to phosphorus is high. The proportion, when it is taken in proportion, the calcium to phosphorus proportion, when it is taken, it is high. But generally, the sodium and calcium content is less. The calcium absorption is better than the cow's milk. The human milk, that is breast milk's calcium absorption is better. Coefficient of iron uptake is 70%, and it has more iron. So we know that the breast milk has more iron compared to the cow's milk. So this is a comparison which is made here. So let us summarize the entire slide. We see the breast milk, it is rich in lactose, iron, and water. The average output for the first 6 months is 600 ml per day, and it can range from 450 to 500. In the 5th to 6 months, maximum output, okay, maximum output of 730 ml is observed. The energy level is 65 kilocalories per 100 ml. And protein, we saw, what did we see? Protein in 100 ml, we had 1.1 grams of protein, okay, 1.1. And in human milk, whey was prominent, and in the cow's milk, casein protein was prominent. And the fats, we saw PUFA, polyunsaturated fatty acids, is more. In that also, the linoleic acid is high. And the fatty acid, that is DHA fatty acid, required for the baby's growth, is also found. Moving on to vitamins, we know it is rich in A and C, it is rich, and B, D, K, it is deficient. And minerals, we saw, what are the minerals? Copper, cobalt, selenium, and iron, it is rich. Also lactose, it is rich. We are studying about minerals, so let's not bring in lactose here. Copper, cobalt, selenium, and iron, it is rich. It is low in cases of sodium and calcium, but the proportion of calcium to phosphorus, it is high. Calcium absorption will be better. Coefficient of iron uptake in cases of breast milk is 70%, and more iron is observed in breast milk compared to the cow's milk. So this was all about the breast milk. Now let us see the conditions in which the breast milk is found to be harmful. It is harmful in cases of infants who are suffering with galactosemia. What is galactosemia? The infant will develop intolerance towards the lactose. They will become lactose intolerant. They cannot digest, or uptake of lactose cannot occur in the body. If galactosomic infant is given milk, the unmetabolized milk, that is the unmetabolized lactose, will build up and damage the liver, eyes, kidneys, and brain. You can see the kidney will be damaged, liver will be enlarged and damaged, jaundice will occur, cataract, brain damage is observed, galactosemic baby. So in cases of in such conditions, they have to not take any sort of milk and milk products, breast milk and the any other sort of milk products have to be avoided. In substitution to that, we have to take non lactose product, okay, which does not contain product, which are meat based products are found. So such innovations have done, and we have to go for such products rather than the milk products in cases of galactosemia. In mothers, okay, contraindications of breastfeeding in mothers. If the mother is suffering from HIV and pulmonary TB, if the mother suffers from HIV and pulmonary TB, but the World Health Organization recommends the breastfeeding under all circumstances. That is, even if the mother is suffering from TB, the World Health Organization recommends to continue the breastfeeding. Women who are on the mothers who are breastfeeding, who are on immunosuppressive therapy, should avoid breastfeeding. And the women who are exposed to high metals, heavy heavy metals like mercury, they have to avoid breastfeeding. And the breastfeeding mothers who are on cocaine, heroin, and amphetamines, because they can affect the milestones of the baby. They can bring in the changes in the growth pattern of the baby. So the mothers who are on cocaine, heroin, and amphetamines should prevent breastfeeding. It is contraindicated. The mild diarrhea, on the other hand, is not a contraindication for breastfeeding. We know that it is not a contraindication. The mild diarrhea, you should not stop the breastfeeding, you should continue it. So let us summarize what are the conditions. Galactosemia, the mothers who are on drugs like cocaine, heroin, amphetamines, alcohol, etc. And chronic alcoholics, and this HIV, TB, pulmonary TB and HIV, it is not it is contraindicated, but World Health Organization says that you can continue in cases of TB. And also women who are on immunosuppressive therapy. This was about the harmful breastfeeding could be harmful in such conditions. Moving on to colostrum. So we see that the breast milk, the first 3 days, the milk which is secreted is considered to be colostrum. So you can see it is liquid gold. They say amrit. It's, amrit. So it's very precious because it's the first milk, the immune milk. The baby gets the immunity from this colostrum. It is very, very important. The first 3 days, the milk which is breast milk of the first 3 days following delivery is the colostrum. It will be yellowish. So you can see a clear cut differentiation between the breast milk and the colostrum. It is thick yellow, whereas the breast milk is comparatively light, it is white. So it's the first milk or the immune milk, also known as Beestings. It contains all the 5 immunoglobulins. You can see the 5 immunoglobulins. IgA, it is rich in IgA, IgD, IgE, IgG, and IgM. You can remember it as GAME. Okay, IgG, IgA, IgM, IgE, and IgD. And it is prominent in it is in IgA, rich in IgA. The high in antibodies, carbohydrates, and protein. We know that it is high in antibodies, carbohydrates, and protein. Protein in colostrum is comparatively more compared to that of the protein in the breast milk. It is low in fat. We know the breast milk is high in polyunsaturated fatty acids, especially the linoleic acid. Okay, but the colostrum is low in fat. Okay, so let us make a comparison now. So the breast milk which is secreted from the first 0 to 3 days is the colostrum. Followed we have the breast milk. It is yellow and this is white. And the contents, it is rich in immunoglobulins. Okay, and it is high in antibodies, carbohydrates, and protein. Carbohydrates antibodies, proteins. It is rich. It is low in fat. Okay, whereas this breast milk is high in fat. Moving on to the nutrients which are found in different types of milk. So we know that under certain conditions, when the breast milk is not sufficient, they opt for artificial feeding methods where they use the other milks which are available in the market. So the other milk, like the cow's milk, which is cheaper alternative in the Indian families, is the cow's milk. We see the Indian families opt for a cow's milk, which is a cheaper alternative rather than going for this lactose powders and so on. They move directly to the cow's milk. And now let us see the comparison what they have made here. In cases of fat, the buffalo milk is rich in fat, followed by the goat milk, buffalo meat, then buffalo milk, followed by goat milk, then comes cow's milk, and lastly we have the human milk. The fat, it is rich in buffalo, goat, cow, and human. Protein, buffalo milk is rich in protein, followed by goat milk, followed by cow's milk, then comes the human milk. Energy, again buffalo milk, goat milk, cow's milk, human milk. Only thing is that in cases of lactose, so we see in cases of lactose, the human milk is rich. Okay, only in case of lactose, human milk is rich, followed by buffalo, goat, and cow. So now we know the order. In case of fat, buffalo, goat, cow, and human. And we see in protein also buffalo, goat, cow, and human. Energy, buffalo, goat, cow, and human. Only in cases of lactose, human milk is rich. So this was all about the breastfeeding. Let us check the MCQ questions which have appeared in the previous question papers, and let us prepare for the NEET pre-PG exam. So we see that under breastfeeding, this symbol can be given. So you have to be prepared, and the latest symbol for the breastfeeding should be known. In 2023, the symbol is enabling breastfeeding, making a difference for the working parents. Moving on, the breastfeeding week. When they ask the breastfeeding week, it is observed in the first week of August. See, breastfeeding B. So 8th month, you can remember like this, B and 8. Okay, so it is observed in the 8th month, that is August. Breastfeeding should be started in cases of normal delivery within half an hour. That is, within the 30 minutes after delivery, the breastfeeding should start. Exclusively breastfeeding should be done for first 6 months. Okay. So this were the MCQ questions. Followed, we have multiple questions we have found in the previous papers in this topic of breastfeeding. We have the milk output, average daily breast milk output in the first 6 months. What did we study? 600 ml per day, and the range is from 450 to 600 they can give, or they can give 500 to 600. This is the range. Okay. Maximum milk output, when they ask, what will you write, guys? 730 ml per day in about 5 to 6 months. And it is seen especially during the 5 to 6 months. The energy output, energy value is 65 kilocalories per 100 ml. Recent study showed that 70 kilocalories is observed. So this range, 65, 70. So this thing you have to remember. And the protein, human milk, which protein is observed? Whey protein. Okay, whey protein in cases of human milk, and in cow's milk, casein. Next MCQ, what do we have? The vitamin A and C. Highest vitamin C among other milks is the, what option you will take? Human milk. Okay, breast milk. Deficient in vitamin K, B, and D. We saw that. Again, let us revise. A and C. The breast milk is rich in A and C, and it is deficient in BDK. The minerals, in minerals we found a question that calcium absorption is better in cases of breast milk compared to the cow's milk. Calcium absorption will be better. The coefficient of iron uptake is 70%. Okay, 70% iron uptake. It has more iron than cow's milk. Which milk dash milk has more iron than the cow's milk? And the option you have to select is breast milk. Followed, we have the World Health Organization recommends breastfeeding under this circumstance. It could be option 1 galactosemia, second option could be HIV, cocaine, heroin, and amphetamine, fourth could be pulmonary TB. So, our answer will be pulmonary TB. In cases of pulmonary TB, World Health Organization recommends to continue breastfeeding. And mild diarrhea is not a contraindications for breastfeeding. They might give a set of contraindications under which the mild diarrhea will be one of the point. So it is our answer will be mild diarrhea. It is a contraindication for breastfeeding. Moving on, the first milk or the immune milk or bee stings is colostrum. That's all. And you also have to remember gamed. You know, right? Gamed, IgG, IgA, IgM, IgE, and IgD. Moving on, the nutrients in different types of milk. We know very well that a human milk is rich in lactose, so the order always will be BGCH. BGCH. But only in cases of lactose, the human breast milk comes in the first. You should remember this photo: buffalo, goat, cow, and human. This is the order. Okay. So with this we come to an end of the NEET questions as well, or a short question, short answer can be asked, or a short essay could be asked in your examinations regarding the breastfeeding. Thank you.